unintentional injury is the leading cause of death in the United States for children from 1 to 9 years of age. On average, 33 children die each day in the U.S. from traumatic injuries, and more than 9 million children are seen in emergency departments for injuries each year. Once an injury or sudden illness has occurred, effective first aid could make the difference between a rapid or prolonged recovery, a temporary or permanent disability, and even life or death. According to the American Academy of Pediatrics, pediatric first aid is the immediate care given to a suddenly ill or injured child until the responsibility for the medical condition and effort to prevent it from becoming worse can be taken over by a medical professional, parent, or legal guardian. It does not take the place of proper medical treatment.
Angela, yell for Ellen. She's trained in first aid.
Okay. Ellen! What is this for? We need your help!
A first aid provider is someone trained in the delivery of initial emergency procedures, using limited equipment to perform a primary assessment and administering initial treatment until emergency medical services or EMS personnel arrive.
Angela, take all the kids back in the room and call the front office.
The essential responsibilities of a first aid provider are recognizing a medical emergency, making the decision to help, identifying hazards and ensuring personal safety, activating the EMS system, and providing supportive, basic first aid care. When you first observe an emergency scene, you need to make sense quickly of what has occurred or is occurring. If a child is injured, how was he injured? The manner in which that force creates an injury is called the mechanism of injury. Mechanisms that transfer significant force are best assumed to result in serious injury until proven otherwise. Does the child appear to be unconscious? A child who appears to have collapsed could be experiencing a life-threatening condition. Your immediate assessment and care could be his only chance for survival. It is normal to feel hesitant because you are unsure of your ability to help. You might hesitate because you feel like you are alone in helping. You are only the first link in a progressive chain of emergency care. Your involvement lasts only until you are relieved by another trained provider or responding EMS providers, in most cases a very short period of time. You might hesitate for fear of making things worse. Your training provides you with sound knowledge and skills designed only to help and not harm those in need. You might also hesitate because you think you don't have a lot of medical knowledge. Extensive medical knowledge is not necessary. First aid skills are based on common sense and simple, effective procedures that can be easily learned and safely applied. Finally, you might hesitate because others have already stopped to help. Stop to assist. Other bystanders may not have any training or may be hesitant to provide care. Emergency scenes are often unsafe. Your personal safety is always the highest priority, even before the safety of a child that needs help. Always pause for a moment and look for obvious hazards. Consider the possibility of hidden dangers. If the scene is unsafe, do not approach. If the location you are already in becomes unsafe, get out. When caring for someone, you can be exposed to blood or other potentially infectious body fluids. While the risk of contracting a disease is extremely low, it is wise to take simple measures to avoid exposure in the first place. Infectious bloodborne diseases include hepatitis B, hepatitis C, and HIV, the virus that causes AIDS. Exposure can occur from the direct contact of infectious material through an open wound or sore, or through the mucous membranes of the mouth, nose, and eyes. Exposure can also occur when the skin is punctured or cut with a contaminated, sharp object. Minimizing exposure lowers the chance of infection. Standard precautions is an approach that recommends managing all blood and other body substances as if they are infectious. Disposable gloves are the most commonly used barrier. Make sure there is always a fresh supply of gloves in your first aid kit. Inspect gloves for damage or tears when you put them on. If damaged, replace them immediately. Always remove contaminated gloves slowly and carefully to avoid snapping. Without touching bare skin, pinch the glove at either palm with the fingers of the opposite hand. Gently pull the glove away from the palm and toward the fingers, turning the glove inside out. Gather the glove you just removed with your gloved hand. Carefully slide your bare index finger inside the wristband of the gloved hand. Gently pull outwards and down, inverting the glove and trapping the first glove inside. Throw away gloves in an appropriate container to prevent any further exposure. Even after using gloves, use soap and water to clean your hands and any exposed skin. Use an alcohol-based hand sanitizer if soap and water are not available. A face shield can prevent mouth, nose, and eye exposure when there's a possibility of splashing or spraining.
Okay. Now the bottom